When the federal government provided critical health care support for families through COVID-19 public health emergency, nearly all Medicaid members were able to stay enrolled in their plans regardless of changes in eligibility or status. That is changing soon, and people covered by Medicaid should start getting ready right now. With us today with more details is Dr. Darrell Gray, Chief Health Equity Officer at Anthem Blue Cross and Blue Shield. Thank you so much for being here, Dr. Gray.
Good morning. It's great to be here.
As we emerge from the pandemic, how will individuals and families who received health benefits through Medicaid be impacted?
Well, Lisa, just to orient your viewers and listeners, Medicaid is a health insurance program that is administered by the states under federal requirements, and eligibility is reviewed typically annually. Now, during the pandemic, people were allowed to keep their coverage without their eligibility being reviewed. However, as we emerge from the pandemic, states again are reviewing eligibility, and so many people could be at risk for losing their coverage.
How big of an impact is this, and do you believe enough people realize this?
Well, I'll tell you, Lisa, as many as 243,000 people are at risk of losing coverage in Kentucky as early as June 1st. And so it's incredibly important that people keep a watchful eye for communications from Kentucky Department of Medicaid in regards to their eligibility. I'll tell you, a recent study demonstrated that up to 60% of people aren't aware that they could be at risk for losing their Medicaid coverage.
How will people know then if they could be impacted? How do they get this information?
Well, they need to stay tuned to their email, their phone, text message in regards to communications from the state. Specifically, Kentucky Department of Medicaid Services will be contacting them if they haven't already, certainly within the coming weeks in regards to this.
If someone is losing their coverage, will they be able to find a new plan that they can afford?
Well, it's very time sensitive. If someone is losing their coverage, they'll need to choose a health plan very soon. And so the good news is that there are options for those who may be losing their Medicaid coverage. For example, if someone is working, they may have access to employer-sponsored coverage. However, if someone is not working, it's critically important that they explore marketplace plans, which could, with new financial assistance, have great options as low as $0 plans for those who need them.
And where can our viewers go for more information on this?
I highly recommend our viewers go to healthcare.gov. That's HEALTHCARE.gov for more information.
All right, Dr. Gray, thank you so much for the information. We appreciate it being here.
Thank you so much, Lisa, for having me.